Health and Mind is a partnership project that brings together Libraries NI, Mindwise, Action Mental Health, Aware Defeat Depression and Cause. And together we're really trying to promote a positive mental health and well-being throughout our community. DCAL and Dard provided extra money in order to bring our health and mind services into the rural communities. By doing this, we were able to bring over 70 workshops throughout Northern Ireland. Those included nutrition workshops, mindfulness workshops, and self-help workshops such as personal resilience, safe talk.
When I came to the mindfulness course, I really didn't know what to expect. I'd never really heard of mindfulness before, but it has been no end invaluable. I've learned so many techniques about living in the present. I would have taken panic attacks in the past, and sometimes if I thought about something that was coming up in the future, it would really make me stressed. So the course has taught me if I connect a visual with something, it makes me more aware. So every time now I think about worrying about something in the future, I think about what I'm doing to my body. This course took me back to the library. You know, that my children are sort of grown up now, they're not in and out of the library. They used to be when we were getting books. I've realised now what all goes on in the library. One part of the day of the programme was a nutritionist, Jane McLennan Kem. She was just absolutely fantastic. Some of the stuff that we've been programmed in our brains about what's good for us, you know, different things that I thought all over the years that was good for us. In a couple of hours, I realised that even looking at sugar contents on the back of packets, I'm obsessed now. I'm going around, it takes me about an hour doing my shopping where it would have taken me 10 minutes because I'm going around looking at the nutritional content, the packet. The information and the advice that she gave us that day was just absolutely mind-blowing. We could put dodgy fuel into our body for near enough a lifetime, and it starts letting us down when we get older, and then we're not really aware of what has happened, what has done it to us. But the like of Jane telling us that what we're putting into our bodies every day has got an effect on our mind. So it has just helped me, I can't tell you, and I've told so many people about the course. I think it's something we should be made to, people should be made to it. It should be in the National Health Service because you really get so much out of it.
Health and Mind is one of the best things that I've ever done, and from my point of view, the key message is really exciting people about nutrition and inspiring them to make small, positive changes for the good of their health. I think nutrition has a huge impact on our mental health. And it doesn't have to be major changes that we make to our diet. Even things like eating a little bit more oily fish, eating things like some more nuts and seeds, so almonds and hazelnuts and Brazil nuts, and cutting right back on sugar and caffeine can really help with mood and anxiety and stress. I think libraries are absolutely essential, and I'm really delighted to see so many libraries in Northern Ireland really thriving. I think they're a real hub of the community, and I've been doing this for about 2 years now through Health and Mind, and people come into libraries to look for advice where they might not go to their health centre, they might not go to their GP, so I think that they're really important.
Tonight we're in Portaferry to deliver a course called Safe Talk, which is a training course designed for anyone from the age of 15 to whatever age around suicide prevention. We'll be covering the tell, ask, listen and keep safe steps as part of Safe Talk, which are the tells that we can spot in a person, how to ask that difficult question, how to listen to the issues that the person might be having, and then how to keep both yourself and them safe. Then we are looking at missing, dismissing and avoiding, which are normal human behaviours that people will undergo just generally in everyday life. But around suicide, they can obviously have much more severe ramifications if they happen. For young people, the benefits would be great because, as we know, suicide is a real issue amongst younger people, especially amongst younger males in Northern Ireland. So having the skills, because these young people are able to spot the differences in their friends much easier than their other adults or their parents might be able to. So with those skills, they can help their friends and support their friends. And from their friends, if they are having any problems, knowing that colleagues or other people their age have had this kind of training, they can get the help and seek the help more easily and more readily and with less embarrassment than they would do if it maybe had to go through an adult.
Take 10 program is a very simple software program which helps people change their body's response to stress and stressful situations. What it does is just simply picks up the heart rate and then converts the heart rate into what's called your heart rate variability patterns or heart rhythms. The program helps people because it allows, for the first time, you can actually see on screen how your body reacts to stressful thoughts, stressful feelings, stressful attitudes, and more importantly, it's allowing you to make changes. We have it in nursery schools, we have it in primary schools and secondary and grammar schools, and it's also being used by parents groups, and it's also being used in the workplace too, actually. It's a great resource for any workplace to have to help their staff deal more effectively with stress.
Having used the software, I was amazed at how sensitive your eye gets stressed a bit when I'm driving, so hopefully I'll be able to use it then. I think I will use Take 10 when I visit the library because I think it's very helpful. I think Take 10 will help a lot of people. For example, students doing exams or people who are feeling stressed for various reasons.
I think Take 10 will benefit the staff because having had the training and knowing the benefits of the Take 10 breathing techniques, it would be great for us to be able to encourage clients as they come into the library with the various issues that the programme is available there and the benefits that they can gain from just such a straightforward, simple technique.